Okay, we're going to move on a little bit and talk about hygiene and vaccinations, which this kind of actually goes into the lecture about at-risk populations, but we'll talk about it all kind of together here a little bit. Hygiene is defined as conditions or practices conducive to maintaining health and preventing disease, especially through cleanliness. Hygiene can refer to a number of different practices that can help keep you and others healthy. There are many ways you can keep yourself and your environment clean to promote healthy living. A few important practices include personal hygiene, proper infant diapering, and feeding and everyday cleaning. Personal hygiene refers to regularly washing parts of the body and hair with soap and water, including washing your hands and feet, grooming nails, facial cleanliness, and covering coughs and sneezes. Personal hygiene practices can help you feel fresh and healthy. Infant feeding hygiene involves the careful cleaning, sanitizing, and storage of infant feeding items such as bottles and breast pump parts to prevent germs from contaminating milk. Safe and healthy diaper hygiene at home or in child care settings reduces the spread of germs and prevents babies and caregivers from getting sick. We see a lot of errors in these ways out where we work and with the people that we work with. Everyday cleaning in places you spend time, like your home and facilities, and in care and educational settings are effective ways to prevent the spread of disease and illness by removing germs from surfaces.
Lysol, people.
Lysol, yes. Simple hand hygiene improved practices could prevent 12% of deaths caused by diarrhea around the world each year, and 13% of deaths from acute respiratory infections. So that's a pretty big number just by simple hand hygiene. However, as of 2022, 2 billion people lack basic hand washing facilities and soap and water in their homes. How many? 2 billion.
Wow.
Lack basic hand washing facilities and soap and water in their homes. How many times do you guys go into homes that don't have running water or maybe don't have hot water?
I'm more disturbed by the having the water and everything being filthy than I am by not having running
I'd
water.
say it's the piles of
Exactly.
cat and dog
There.
poop scattered around the
Yes.
house.
And the
Yes.
cockroaches, you move something, and the cockroaches and bugs just start crawling. You're hoping they're not going up your pant leg.
That's right.
They try to rearrange it while you're
But,
moving it.
yeah, we see a lot of it, and the best you can do is try and get the heck out of there as quick as possible.
Yep.
Homelessness is increasing even in our community.
Yeah.
These people do not have any way of maintaining personal hygiene. Infrequent showers and laundering clothing has been associated with increased risks of parasitic infections.
Mhm.
One of those places where they have big truck stops is kind of nice because you see these people, even though you know that they're homeless, going into those places and actually showering.
They do.
Yeah, but hell, that's $15.
Yeah, it costs money.
Costs more to go to the doctor when you get sick.
Sleeping outdoors has been identified as a particular risk factor of increased prevalence of scabies and body lice. The severity of these infections may be intensified by comorbid conditions and reduced access to early treatment. So, however, reduced hygiene is also a risk factor for skin infections like MRSA, especially in your IV drug users. And so we see that. We're even seeing that in Little Fulton County and Sharp County, you know, with homeless people that are carrying those things around. These infections may have particular severity for people with limited access to follow-up care and on emergency providers where many people experiencing homelessness receive medical care. Limited access to sanitation may also exacerbate chronic diseases such as HIV and diabetes. Personal hygiene has also been identified as a positive contributor to mental health among persons experiencing homelessness. Despite the importance of personal hygiene and the challenges faced by people experiencing homelessness in maintaining personal hygiene, few studies have explored hygiene-related self-care practices among people experiencing homelessness in high-income countries. So I think that's something that powers that be are starting to look at a little bit more is what the spread of disease risks are with the homeless populations. Be aware that there's limited availability of shelter services or public showering facilities in our area. So we really don't have a lot of places to refer these people to, so that's rough.
Nope.
Getting vaccinations is a practice in maintaining health. It's also a very personal decision based on beliefs or preferences. Baxter policy allows each person the right to refuse vaccinations, except in the case of dietary workers who must have the hepatitis A vaccines.
Thank you.
That's required by the state health department. Recommendations include Tdap every 5 years, hepatitis B, MMR, varicella, influenza yearly, and updated COVID vaccines as they are released. So we're talking a little bit about at-risk populations along with this lecture, and I just kind of made a list of some of the at-risk populations that we see, and I wanted us to kind of talk about these things as they came up. But infants and children, especially in the unvaccinated, these people are prone to any type of disease process, picking up things. These are the type of people that you see and we pick up out there and bring into the ER, especially those who are unvaccinated. And we're seeing more and more and more of those all the time. You know, I know people have a lot of different opinions about vaccinations, but sometimes with children, that's kind of a thing that needs to be promoted a little bit, I think. Elderly, especially those who live in congregate facilities. What are we seeing among the elderly so much in the nursing homes?
Ooh, COVID.
Flu, COVID, a lot of pneumonias even.
Yeah.
A lot of them are so sedentary though, they don't get up and move around.
That's right.
They just make everything.
The Candida, the yeast is spreading in the congregate facilities.
Dealing with foster kids, majority of the time when they receive nutrition care, they lack immunization, which goes on to what you said. My concern on that, when I was in school, you had to have certain immunizations before you were allowed into public school. So I don't understand a lot of the times why these children are admitted into.
I don't either. Apparently that's something that the government has decided that was discrimination by not allowing people with unvaccinated children to use the public school system. But I'm like you, when I was a kid, you had to have your vaccine so you couldn't go to school.
Yeah.
And homeschooling wasn't really, I mean, I suppose there were people that did it.
There were a few. It wasn't quite as many.
About 40
Yeah.
years ago around
Yeah.
here. Well,
You know,
45 years ago maybe.
I disagree with letting unvaccinated kids into the public school system. I think that that's been a big.
Well, I
proper
mean,
channeling, if you have the doctors now, a doctor,
yeah.
saying you don't have to have it or whatever for allergy or whatever medical reason that there is to that. But yeah, I don't.
It's because, one, we don't pay attention to the data. I mean, there's billions of pages of data. I mean, billions of people who've had it and millions of pages of data about that they work, but we don't want to pay attention to that, some of us. And then we've also got the personal belief, don't put that strange substance in my body, whatever, for religious or just personal, which I also get. But at the same time, I think perhaps your personal opinion is putting my kid at risk, when data suggests it's better. So, where's the balance? And I guess that's more of a political question, but if you make my kid sick, I don't care what you think.
Very big ethical
Debate.
I mean,
Well, when it comes to kids being taken away though, that don't have that stuff, there's other factors that go into it because the Amish don't vaccinate their kids. You got people.
Well,
that
the kids aren't being
people
taken
that-
away because they're unvaccinated, it's just.
Yeah,
What
that's,
I'm saying is
It's
that
a
the
neglect
factors that
issue.
go
Yeah,
into
it's-
it.
it's,
It's not just that, it's
it's-
other factors.
Absolutely, but the people that are in populations like the Amish, they have their own school systems.
They have pretty decent
Yeah, it's-
hygiene too and things like that
Yeah,
for the
they
most
don't
part.
have-
They actually have some care about that kind of stuff.
That's for sure.
It's not like, oh, we're poor, so that means we're not gonna shower. We're not gonna.
yeah, I grew up poor, and trust me, I didn't get away without getting a bath.
I did too.
I don't want to take a bath tonight. I don't care what you want, kid.
Yeah, yeah, yeah,
You're into that.
yeah. Actually,
Grew
when I
up
was
poor, I'm
real
living
little, it
poor,
was the
what's that?
metal tub in the utility room with hot water.
Mhm.
No, 'cause we didn't have a bathroom until I was probably 5 or 6.
I remember briefly as we were transitioning to one house, which we were building, we lived in a house that had very limited running water. So there was only one sink in the house that had running water, and you had to carry water to the tub.
Yes.
And that was,
And boil water.
I don't, I have very vague memories of that, but I remembered the process.
Yeah. I
That
can
was
remember-
preschool for me. I
I
mean,
can remember
little
the
kid.
outhouse too. Dad.
Probably got it.